My name is Teh Zi-Siong. I'm 44 years old. I work as a business communication manager in a local company, and I suffer from sleep apnea. When I got married about 10 years ago, my wife told me that I snore a lot and I often stop breathing during the night. And at work, I was also very lethargic. I often fall asleep in the meeting, and when I attend courses, I also doze off easily.
Now, obstructive sleep apnea is a condition that affects the airway with recurrent collapse during sleep. It's a relatively common condition that affects about 15% of the adult population in Asia. There are many symptoms of obstructive sleep apnea. First off is snoring. The snoring is due to the collapse of the airway during sleep and can disrupt the sleeping partner. It can also be embarrassing for some patients. Poor sleep quality can result from the recurrent choking during sleep, and this can result in poor memory. It can affect the concentration during the daytime and can affect the work or school performance. However, there are other important aspects to sleep apnea as well. First is the increased risk of medical conditions like high blood pressure, heart diseases, strokes, and diabetes.
When my family life, work life, and social life has been affected, I think that it's about time for me to do something about it. So I decided to see my company doctor, and he recommended me to see an ENT doctor. And he thinks that I may be suffering from sleep apnea. So he referred me to a sleep test at the hospital.
What happens during this sleep study is that you sleep during your normal sleep hours, and monitors are put onto the body to look at several body functions to see whether there's any interruption or choking during sleep. There are many treatment options available. Generally, we start with the non-invasive treatment options. First off are behavioral measures. So those who are obese need to lose weight, those who drink a lot of alcohol need to cut down, and those who smoke need to stop smoking. But for more severe obstructive sleep apnea, these measures will not be enough, so more aggressive treatment options need to be done. There are a few available. First off is continuous positive airway pressure, which is also known as CPAP. There are dental devices that you can use, and surgery may be suitable for some patients as well.
And at the end of the test, I was told that my breathing stopped 50 times in an hour, which was very alarming to me. So the doctor actually recommended me to use a CPAP machine.
Usually we start with continuous positive airway pressure treatment, and this is a device that is connected to a mask that you wear during sleep, which helps to push air into the airway and helps you to breathe easily during sleep.
When I first got this CPAP machine, I was very surprised because, wow, it's so small. I decided to try it on, and the mask is also less intrusive and very comfortable for me to use. So during the night, my wife and I sleep very well.
There have been several developments in CPAP technology that help to improve CPAP compliance. First off, mask designs and mask materials have improved a lot, and this makes it more comfortable for the patients to use the mask. Secondly, machines are now smaller and quieter, and the use of the machine does not affect the sleeping partners.
After using this new CPAP machine, I stopped snoring altogether. So it means good sleep for my wife and myself. With the added rest, my energy level has gone up and it has improved my work a lot. In terms of family, I could also spend more time with my kids, my wife, and we go outings a lot. This machine, because it's so compact and small, I could bring it anywhere with me, to overseas, to a friend's place, to a chalet. This is really good for me.
Now, if you think you have symptoms similar to Zi-Siong's, or you think you have obstructive sleep apnea, it is important to see a sleep physician to get yourself tested with a sleep study to see if you have obstructive sleep apnea.
If the doctor diagnosed that you have sleep apnea, I would recommend you to use CPAP machine because CPAP machine has changed my life in a positive way.